Hello, I'm Ryan Saxe, Superintendent for Cabell County Schools. It is Thursday, March 12th, 2020, and I'm coming to you to provide you an update as to where the school district, Cabell County Schools, is as it relates to preparations and information that we've been receiving for the coronavirus COVID-19. I'm joined with Dr. Kilkenny with the Cabell County Health Department, who will provide us a little update as to where we are as a community and as an area as it relates to the coronavirus. And then I'm going to talk to you a little bit about some preparations that the school district is taking to not only mitigate the risks, but what we will do in the event that there is an outbreak in our community and that it impacts one or several of our schools. So Dr. Kilkenny, thank you for joining me today. We are in constant communication with your office as it relates to the coronavirus situation. And of course, all of our releases and information that we're trying to share with our families and our employees, we collaborate with not just the health department, but district emergency management as well. Can you just sort of speak to that process of how we come and collaborate to make decisions?
Sure. We've been working, obviously, talking to each other quite frequently, and it really starts in a bigger organizational sense at the Homeland Security meetings that both our agencies attend. We both participate in the local emergency planning committee, and things like pandemic flu are exercises that we've all participated in together. Mm-hmm. So now we're in a real world situation where we do have a recently declared pandemic. This is with the novel coronavirus that we're calling, for the disease we're calling COVID-1. The disease we're calling COVID-19. Mm-hmm. And it does require a real response because it's a serious public health threat.
Correct. And of course, we're taking all those things seriously in our interagency, collaboration. But I think it's important to note that our organizations aren't working in isolation. We're working together, we're sharing information, and we're trying to make decisions on what is in the best interest of our community, and in the case of our school district, what's in the best interest of our students, our employees, and the community.
Yeah, that's right. This disease will affect the entire community, and the public schools are more interwoven into the fabric of our society than a lot of people recognize. So it isn't even just you and I communicating about this. There are lots of other agencies that get involved when we're talking about a school closure.
Sure. And of course, in our community, people are already seeing that across state lines and even inside the state of West Virginia, that some events have been starting to be canceled. Can you speak to maybe the importance of why we would want to make sure that we have continuity of learning and of our school system?
Well, let me first start with why the planning is important and what kinds of decisions we make. As a pandemic sweeps across the globe, it'll affect different communities at different times. So one community might be doing something that another community is not doing, but it's not time yet. So that's one aspect of preparation that people need to be aware of. And then when the disease actually comes to the community, there are different actions that are important at different times.
Sure.
And so when we consider school closures, if we would do that, we would want to do that at the time when it's actually going to help, which is really going to be early in the process, and do that proactively to stop the spread of the disease rather than waiting until it's widespread in the community and closing the schools won't make any difference. So we might be really talking to you about that kind of disease management aspect, and then relying on you and your expertise and your knowledge of your schools and the community to actually accomplish something like that.
Sure. And so, I think the thing that's important to also think about is that because at this point there's been no reported cases of coronavirus in West Virginia, that if and when the first case hits Cabell County, it may not mean that at that time is the most appropriate time to close a school, but it could. And so that's when, you know, our two groups are going to collaborate around, again, what's in the best interest of the community, the schools, and our employees. And that decision won't be made in isolation. We'll work together as to what schools could be impacted and where those potential, situations may occur.
Yeah, and I know that there are people wondering, and what I just said earlier, you close early, why haven't we closed this early? Well, you closed too early, you haven't accomplished anything.
Mm-hmm.
So you really want the disease to have made its appearance and to demonstrate its threat, its immediate threat,
Sure.
before you take action. So we would be looking for a case to occur or a cluster to occur, and we would want to then do our public health investigation and our case finding to determine, does that touch the school? If it doesn't even touch the school may not have any reason to react.
Yeah, that's a really good point. And of course, leading up until the point when there could be a case in Cabell County, you know, it's important to note that what our school district is doing to enact preventative measures is also extremely important. So, you know, having our increasing the methods that we're sanitizing our schools on a daily basis. You know, our custodians and our faculty are making sure that surfaces are wiped down, doorknobs are clean, water fountains are disinfected, our restroom facilities, the common touch places are being addressed, you know, at least twice a day within our school district. That also includes our vehicles, our school buses. Mm-hmm. After the morning run and after the evening run, buses are disinfected, the seats are disinfected, whether that be through our mechanical sprayer systems or wiping down with the cleaning agents. Those things are being, you know, addressed. And then, of course, in our classrooms, we are practicing and trying to provide reinforcement of appropriate hand washing techniques with our students. You know, I was just in a classroom this morning, and I was talking with the students, and I said, now, how long do you have to wash your hands? And they said, you know, they have to sing Happy Birthday twice in order to make sure that their hands were appropriately washed. And so that information is getting to our students, and I think that goes a long way in helping curb the spread of this virus. Would you agree?
Oh, that's exactly right, and now is exactly the time to be doing that. Good hand washing, application of hand sanitizer if you can't, cleaning of surfaces, cough etiquette, like coughing into your sleeve or
Mm-hmm.
coughing into tissues and how to deal with that. I know you're already doing all those things, and this is the time to do those things, so your response is perfect.
Yeah, you know, our school staff is committed to making sure that our students are implementing those best practices, and so I think that's been very, very helpful in our school district. When students return prior to spring break, informational packets will be provided to students, or information will be provided as to where students can access the information should an extended closure occur.
Well, those are really good preparations, and from a public health standpoint, you're really covering a lot of the bases that we want covered. If we would have a situation with school closure, we really don't want those children to leave the school and then go congregate someplace else. So we would want them to have access to the food services that you've discussed, and that internet access sounds great, and to be able to access that from their cars without having to get together again in another group that we're trying to avoid.
Sure.
Or those groups could be small, and especially in a well-ventilated area, that's going to really minimize the risk. It's going to minimize the loss of instructional time. It's going to give the kids some structured activities to do, and it just sounds great.
Absolutely. The other thing that I think is important to note is, and this is for our employees, is that should a situation arise as it relates to our district office, that our finance department is developing a plan for continuity of service as well, so that payroll and accounts payable and those sort of things are able to continue, so that we have continuity of service for our employees and for the school district as well. I think that's something else that's important to note. And so I think that as we continue to evolve in our planning, that we are attempting to address every unforeseen circumstance that could occur. While we plan for these events, you really get to put it to a test when a situation like this arises. And one of the things that we will continue to do is we will continue to collaborate with the health department, emergency management, and we will continue to try to resolve the issues that our community identifies in order to work together through this issue.
Well, I wish that as the health officer I could predict to you when we're going to have to implement this, but the disease is unpredictable in that manner. We are the last state in our surrounding area to report no cases, and when we get a case in West Virginia, which we anticipate, I don't know whether it will be here or across the state and what our risk will be. Certainly having spring break as a buffer is a good thing. We would anticipate any closure to be as short as it could be to effectively stop the virus, and we would expect schools to open again, I believe, but the circumstances are changing even as we're sitting here, and we don't know what we'll be facing a week from now or 10 days from now as the students get back from spring break.
Absolutely. But we'll be prepared to communicate and make those decisions together.
We will.
Dr. Kilkenny, I think that with what we see in the media, and of course as fluid as this thing is, there's new information coming out all the time, it's only natural to be concerned and to have worry over what's going on in our community, but what's going on with our children. And so what advice do you have for the public as it relates to what they're seeing and what they're hearing?
I think that people have a reason to be concerned, and we understand the anxiety that this kind of a situation provokes, but people should get good, reliable information from reliable sources, and they should take the actions that they can to implement the recommendations and reassure each other that everything that can be done will be done, participate in that process, and everybody get ready to take care of each other besides focusing on yourself. When you focus on yourself, your anxiety tends to drive more. When you begin to think of others, it opens you up and your anxiety drops, and then you can take more rational action.
Yeah, that's one of the great things about our community, though, is we live in a community of very caring, family-oriented individuals that want to take care of each other, and that's one of the great things about living and working here in the Cabell County area. And of course, when we're talking about accurate information, I think it's really important that our students and our parents and our employees know that the most up-to-date information, the most accurate information that they can receive as it relates to how the school district is handling and addressing and preparing for coronavirus can be found on our school district webpage. There's a specific link there for coronavirus updates. You can check that out. In addition, all of our social media pages on Facebook, Twitter have updated releases from the school district informing them of where we are in our preparedness and our planning and what should occur if a decision has to be made. Is there any other valuable sources of information that people can look to for in the community?
Sure, and what you're saying there is really key. When I need information about what's going on with the schools, I want to get it from the schools and not from other people who heard it from somebody else.
Right.
That's not necessarily the best source, not that it's wrong, but from a health perspective, cabellhealth.org is our website, and we have links there to good information for local use, and we have links to state and national health information in regards to this disease. And this disease situation is changing so fast that you really need to refer to those sources pretty frequently in order to catch the updates and the changes in the recommendations as they're occurring.
Dr. Kilkenny, I want to thank you for taking the time to come into our school district office.
Thank you for inviting me.
Yeah, this update I think is very important, and of course I look forward to our continued working relationship as this situation evolves. You have been a true partner with us, and you know, it's wonderful to know that you're just a phone call away so that we can make a decision in collaboration of what's best for our community.
And I work with other health officers from all across the country, and some of them don't even know who their superintendent of schools is. So we have a great working relationship here in Cabell County. We do stay in touch, we do work together, and that's how we're so successful in Cabell County when we have a threat or a concern like this.
All right, thank you. Well, thank you for joining us. Again, you can find more information and updated, accurate information regarding the school district's preparedness as it relates to the coronavirus on our school district webpage, cabellschools.com, or again on our Facebook page or our Twitter page. Thank you.